Understanding meningitis, a serious threat. Meningitis is a serious infection. The membranes surrounding the brain and spinal cord are called meninges. Meningitis occurs when these membranes become inflamed. The severity of the infection can vary depending on the cause and how quickly it's treated. Causes of meningitis, viral and bacterial culprits. Meningitis can be caused by several different agents. The most common culprits are viruses and bacteria. Viruses that commonly cause meningitis include enteroviruses, herpes simplex virus, and West Nile virus. Bacterial meningitis is less common but far more serious. It can lead to severe complications such as brain damage, hearing loss, or even death. Common bacteria that cause meningitis include Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenzae. Other less common causes of meningitis include fungi, parasites, and certain medications. Identifying the specific cause is essential for determining the appropriate treatment. Recognizing the symptoms. Early detection is key. Meningitis can manifest with a range of symptoms. Recognizing these symptoms can be life-saving. Common symptoms of meningitis include a sudden high fever, stiff neck, severe headache, and sensitivity to light. These symptoms often appear suddenly and rapidly worsen. Other symptoms may include nausea, vomiting, confusion, and a rash. In infants, symptoms can be subtle, such as irritability, poor feeding, and a bulging fontanelle, which is the soft spot on the head. Early diagnosis and treatment significantly improve the chances of a positive outcome.